Good evening and welcome to our Fall Engineering Lecture. I'm Nancy Albritton, Dean of the College of Engineering. Thank you for joining us this evening. While we really wish we could see you all in person at Kane Hall, we are still quite happy that you've joined us for this timely topic. Contact tracing is in the news. A recent headline proclaimed, "Contact tracing, key to reining in the virus, falls flat in the West." Tracing is seen as a vital tool to avoid lockdowns as we open our economies, but that requires a robust system, widespread rapid testing, and public trust. The University of Washington has been at the forefront of the pandemic. We were the first to move students to online classes, and our COVID-19 testing efforts have helped set the standard across the country. And the College of Engineering in particular, our faculty, staff, and students, including our speaker today, have helped lead the pandemic response, from PPE manufacturing to developing models that simulate the impact of different interventions. Stefano Tesoro is an associate professor of computer science at the Allen School, and his research centers on cryptography, computer security, theoretical computer science. His work in privacy preserving systems is why he joins us this evening. He, along with other faculty at the UW and in partnership with Microsoft Research, pivoted their work at the start of the pandemic to study the feasibility, efficacy, and security of digital contact tracing. Tonight, we will share an in-depth look at the use of this technology, as well as the findings of his research group in app development. Following his presentation, Stefano will answer some of your questions. We've already received questions from many of you. You can also email questions during the broadcast to coe@uw.edu. Please join me in welcoming Stefano Tesoro. We're delighted to have you.
Thank you so much. Good afternoon, everyone, and thank you so much for the introduction, and thanks to all of you for being here and tuning in. So the goal of this lecture is to give an overview of current solutions for digital contact tracing. And I feel particularly honored to present this work here tonight. I'm, in fact, part of a much larger effort that initially included about a dozen researchers and faculty at the University of Washington, Microsoft Research, and other institutions. And that has led to a project called PACT, which I'm going to talk about here tonight. And this has in turn become part of an even larger initiative called Common Circle, which is also based here at the university, and that has been advising the state in the development of a digital contact tracing solution. So most of what I'm going to talk about tonight comes from lessons learned in this context. So the important premise for tonight is that as long as no vaccine is available, the most effective strategy against the COVID-19 pandemic is to test, trace, and isolate. This approach has been very effective already against a number of diseases in the past, and it is our best bet so far. The basic idea is to test as many individuals as possible, usually after they report some symptoms, and if they do test positive, we want to reach out to all of their contacts very quickly to isolate them before they can spread the disease even further. And a central element of this strategy is what we call contact tracing. So this is a process that starts whenever an individual tests positive, and the lab reports this fact to the health authorities, and this is going to trigger a so-called contact tracing interview. In this interview, which usually happens simply over the phone, a case investigator or a contact tracer will ask the positive individual some questions, and in particular about their contacts over the last few days. And these contacts are going to be, in turn, notified, also over the phone usually, about a potential exposure to COVID and asked to isolate. So the process here is entirely anonymous. One doesn't learn the source of the exposure when notified by contact tracers. Contact tracing is by now a well-established process already. For example, you can see here some recent local data from King County, which has a team, as far as I know, of around 60 contact tracers and case investigators today. So on the left, you can see that out of almost 900 cases that we unfortunately had in the week of October 4th, 86% of them have been subject to a contact tracing interview. And on the right, you can see the other side of this, namely that in the same time period, there were attempts to notify around 1,200 individuals, and all but around 7% of them have been successful. So this should give you a sense of the sheer size of the process. So it's really a large effort, and this is really a large number of phone calls also that contact tracers have to make. And so in the end, what we see here is that contact tracing is a process that requires a substantial amount of human resources, and which is inherently based on human interactions. So one concern here is that the information collected in interviews can be both inaccurate and incomplete. And hence this could impact the accuracy of the overall process. And this is in fact for two good and completely natural reasons. The first one is that individuals simply tend to forget about their contacts. And this is even more true during a high stress situation. Imagine you just learned about the positive outcome of a test. And the other point is that contacts are often with strangers, for example, on public transit or at social gatherings. And so the question that we are going to ask here tonight is whether traditional contact tracing, as I described it so far, can be helped by technology to obtain more accurate and reliable information, and in particular, whether this can be done using smartphone apps. Now, in fact, the media has extensively covered already smartphone apps to support contact tracing, and you might have seen some of the articles and the headlines. Some of them are positive, some of them are negative, and some of which, in fact, involved our work done here at the university. And in fact, you should be interested in the topic, as the current plan by the Washington Department of Health is to roll out the technology statewide by the end of November, following up on a pilot that we run here at the university in the next few weeks. So the goal of this lecture is to provide to you enough information to walk away with an informed, objective opinion about these technologies. So the most prominent functionality that smartphones promise to provide is something which is by now known as exposure notification, which is really something which is meant to exist on top of the existing conventional contact tracing process and not to replace it. So exposure notification relies on the assumption that a large number of us carry smartphones with them most of the time. So should an individual become ill and test positive, we would like to alert all of the other individuals whose smartphones have been in direct proximity of the positive individual. So in particular, users would be running an app that would display on screen an alert about a possible exposure. Of course, proximity here should be measured in a way which is epidemiologically relevant. So we will follow, for example, CDC guidelines that suggest that anything which is being within 6 feet for at least 15 minutes should count as an exposure. And there are several techniques that phones can resort to in order to detect proximity, but they are really not all equal. In fact, the initial attempts to detect exposures have used simply cell tower location information available to cell phone operators and the triangulation to locate phones. And this can be improved, for example, by using the GPS chips that are directly available on the smartphones. But both of these approaches end up being rather imprecise. So they give good rough estimates of absolute location, but these estimates can be somewhat imprecise. Imagine if you're using GPS indoor, and they don't provide enough resolution to detect whether two phones are too close to each other or not. And so they ended up being discarded. And the technology that has been favored instead is something known as Bluetooth Low Energy, which is a variant of Bluetooth, which allows smartphones to send messages to each other when they are in proximity to each other. So think about at most a few dozens of feet from each other. And also by measuring signal strength, phones can also get some rough estimates of how far they are from each other. So this technology was the one that has been favored. But before I continue and tell you how it is actually leveraged, it is, however, good to pause for a few moments to acknowledge here the very big elephant in the room. Namely that it is hard to think about any system which is meant to detect exposures via proximity of smartphones without being at least a little bit concerned about privacy. There seems to be an inherent risk that the system might collect too much information and might be used to track users. Of course, whether this is really the case depends on many factors, but the concern is nevertheless valid and healthy and should be addressed. So to see how we could address this concern, it is very helpful to compare the situation with conventional contact tracing, as I described it before, because this too inherently comes with privacy concerns. In particular, we do reveal sensitive information about ourselves to contact tracers, and also notifications about an exposure themselves, even though they are anonymous, they can still reveal the source of the exposure. For example, if we have been in touch only with one or two individuals over the last few days, we are pretty likely to guess who the exposure is due to. Still, I will venture to say that most of us are not as concerned about this process, perhaps a little bit, but not as concerned. And I think it is fair to say that one reason why we are not as concerned is that we do trust the system to a high degree. And indeed, if we look at the recent Gallup poll, which I'm showing you here, looking at the most trusted professions in America, we see that professions such as nurses, medical doctors, and pharmacists, so essentially everyone working in the public health sectors, are among the most trusted individuals in society. And as an aside note, I will not go through the entire ranking here in order not to offend anyone in the audience, but you can look up yourself here and see where you're standing, just to make a comparison. So it is clearly indicative of the high degree of trust we generally put in public health. And contact tracing is a process within public health, and it can benefit from this trust. Now, of course, we are aware that there are several flaws in the healthcare system, some of which actually pertain to privacy. But by and large, we accept them as part of our lives. We are used to sharing personal details with doctors, and that's something we are used to. The situation is very different for apps on smartphones. We are almost pre-trained not to trust them. Or at least we understand that in many cases, their functionality comes with a certain privacy risk. And so this makes it inherently challenging to trust apps as a component of a public health response. In fact, if we look here at another poll, which was run by the Washington Post in the earliest stages when exposure notification technology was being proposed, we see that smartphone users are almost evenly split on whether they will adopt such technology or not. And the article that comes along with this poll states that a major source of skepticism is distrust in tech companies, and that there are doubts on their ability to protect the privacy of health data. And so, for this reason, what is clear is that we need to set a much higher bar to ensure trust for exposure notification applications so that citizens actually trust them and want to use them. And this is achieved by a number of guidelines that we have established in the development of such applications that include foremost what I call here privacy by design. So what that means is that the system is designed in a way that no information is ever available to the service. And so we do not need to be concerned about tech companies or authorities holding any data, because there is no usable data to be held at all. And this effect should come with appropriate governance models and legislation that can further increase trust. And the system should, of course, give us a clear benefit. So it should give us accurate information that we can rely upon, and participation must be voluntary, so nobody should force you to use it. And another aspect is also important to make sure that these systems are only used in the context of a pandemic. So we need to be guaranteed that they're going to be phased out as the pandemic comes to an end. So the question here is now, how does this work, and how did we achieve such privacy by design? So the common denominator of all exposure notification systems that have been proposed is that when a user signs up for the service, their phone will start broadcasting signals in their proximity using Bluetooth. So these signals do not go far, and they are completely anonymous. So you should think of them as large, unpredictable random numbers, which are in particular unrelated to anything the phone is storing on them, and also any private information about the user. And in fact, these signals keep changing over time, every few minutes, to a new unrelated random number. And so this alone is already preventing tracking, because if an adversary, an eavesdropper, sees two such signals, they cannot tell whether they come from the same phone or whether they come from two different users. And of course, for this to make sense, during this process, every phone will have to remember something, and they will remember both the signals that they have seen in their proximity, as well as the ones that they have broadcast themselves. And generally, these do not need to be kept forever. They need to be kept for a limited amount of time, say 2 weeks or whatever the relevant infection window is going to be. Now, from this point onwards, different systems have taken different approaches to actually alert users about exposures. And the first such exposure notification solution was actually put forward in Singapore in early March. And similar solutions are now used both in France and Australia. And the basic idea is, upon being tested positive, a user interacts with the health official and is given a so-called upload authorization, which usually is some form of PIN code to be inserted by the user in the app. And this will then, in turn, trigger an upload over the internet to a remote server, which is managed by the health authorities. And this upload will consist, in particular, of all of the signals the phone has collected in its proximity over the last few days. So these are signals broadcast by other users that have been collected by this positive user. So now some actual magic is going to happen. Even though I promised to you that these signals are entirely anonymous, the health authority actually has some sort of superpowers here. So thanks to the use of cryptography. In particular, the health authorities can actually learn the identities of the sources of the signals that have been collected by this one positive user, so that they can be alerted about a potential exposure. Now, these superpowers are crucially only available to the health authority, which has some sort of magic cryptographic key that allows them to de-anonymize these signals, but nobody else, without knowing this key, is able to de-anonymize these signals. And so as soon as this solution was proposed, and we usually refer to this solution as a centralized solution, there was almost immediately a lot of criticism. In particular, in order for this to work, we need to trust the authority to only de-anonymize signals whenever necessary, and not to abuse of this magic key. For example, to track users who are not involved in a COVID infection as they go about their lives. And this is, of course, challenging, as it requires oversight and legislation to make sure this is indeed in place. And it also exposes the authority to legally to potential lawsuits if they are not sufficiently trusted. And so this is where we entered the picture with our PACT project here. And in fact, I have to say that almost at the same time, 3 other projects came up with similar solutions, which we refer to as decentralized solution, which do not require any such magic key and any trust on the authority. In fact, as a funny side note, perhaps as an indication of the pace at which progress happened in late March 2020, both our team and a team at MIT launched solutions with the very same name, PACT, and they were published almost simultaneously on the same day, at the point that we didn't notice we were using the same name. So things were very hectic. But these 4 proposals then, in turn, inspired what is now the Apple and Google exposure notification platform, which is being widely used. So what's the difference with these decentralized approaches? So the difference starts in a decentralized system when the user is issued an upload authorization and receives a PIN to be inserted in the app. Now, what happens here is that what is being uploaded are all of the signals that the phone has broadcast in its proximity over the last few days. Okay, so remember that in a centralized solution, what was being uploaded were the signals that the app and the phone has received. Now we are uploading those that have been sent. In particular, the server these signals are uploaded to is typically run also by a health authority or perhaps a non-profit entity. And effectively, the server only needs to act as a public bulletin board. So all of the signals posted to the server are available for everyone to see. There are no hidden secrets that whoever runs the server needs to hide. And now the other users of the app will have their apps, in fact, automatically check for new signals being posted on this bulletin board. And if they can spot some signals that they have previously seen in their direct proximity, then they know that an exposure, a possible exposure, has taken place. And this will trigger an alert in the app that the user will get to see. In contrast, if an app doesn't see any signals that the app has seen before in the proximity of the phone, then no alert is going to be displayed. So here it is important to see that this solution offers a very high degree of privacy for users who, in particular for users who have not reported positive. So in fact, no information about them is ever revealed by the application. So only anonymous signals are broadcast in their proximity, and they are never uploaded anywhere by any other user. And as I said, these signals are entirely anonymous. And moreover, if one of these users is ever alerted about an exposure, this fact is only known to the user. So it is really entirely their responsibility to act responsibly and report to health providers and seek testing. So we really rely on voluntary compliance on the side of the users. Now, what is, however, also fair to say is that not everything is perfect here, and there are some leftover privacy risks for those users that report as positive and upload these signals that have previously broadcast to this public server. Specifically, we cannot prevent hackers to come up with malicious versions of the apps that might, for instance, store these signals together with location and time informations when the signals have been detected. And so this could allow them, in case they receive an exposure alert, to come back to the identity of the source of this exposure. For example, if they stored some other information like camera pictures of their surrounding. And in fact, because of the way the actual systems are optimized, it is usually possible also for these malicious actors that might run a malicious version of the app to detect whether they've been in proximity of the same individual throughout a single day. And malicious apps can also do not need to comply with the specification of the system. So they could, for example, synchronize and send the same signals at multiple locations. And this can also affect accuracy of the system by potentially alerting more users of exposure. And these are actually false positives. They're not real exposures to a single individual. So all of these issues are actually fixable, at least in theory. So we do know how to fix them. But the solutions that we are aware of are impractical. And so this was accepted as a trade-off, especially considering that leveraging these weaknesses is not immediately obvious from a technical standpoint. But there was, in fact, a very heated debate around March, April of this year between supporters of centralized solutions and those supporting decentralized solutions, which has mostly taken place in Europe. And in the end, two factors contributed to the adoption of decentralized solutions. The first one is that Google and Apple have launched their own solution for exposure notification based on our existing academic decentralized solutions. And so the help from Google and Apple was also somewhat necessary at that point, because we did try also here at the UW implementing our own app, but it was quite hard to get something reliable and energy efficient without their help in integrating it with the operating systems that they are responsible for. And also another factor is that the academic security and privacy community, as almost, well, at least an overwhelming fraction of it, has taken a position in favor of decentralized solutions and started advocating with them. And so for them. And so fast forward today, we can see that a number of countries have already deployed exposure notification solutions, and many more are actually to come. And all of them, with the exception of France, Australia, and Singapore, have adopted decentralized designs, almost always using the Google Apple framework. And there are plans, as I said, in many more countries to adopt these solutions. In the United States, however, adoption has been fairly slow. And this is mostly due to a total lack of federal coordination, which has actually put the states in the position to have to independently decide on their strategies. And states were usually overwhelmed with much more immediate and pressing issues than these apps. But we are seeing growing adoption, and I expect this adoption to grow much more over the next few weeks, especially considering that Apple and Google have launched an in-house solution called EN Express that will not require the states anymore to have someone develop their own apps. They will only have to supervise the deployment of this Google Apple solution. And also, you have to be reassured that whatever is going to be deployed will also support cross-state roaming. So if you live in Vancouver, Washington, and you work in Portland, you don't have to be concerned about crossing the border and missing some potential exposures because of that. So the final question here that is still open is, whether these solutions actually work in terms of reliability. Because I convinced you perhaps about the privacy aspects, but all of this is pointless if they don't give reliable information. And here, there is actually some irony, because the fact that we're designing this solution with privacy in mind, somehow prevents us from accurately assessing whether the system actually works as it should. For example, we do not know how many users are notified. This information is hidden from everyone, and whether users act upon such notifications. So all we can do here is resort to voluntary user studies. And one such study was carried out, for example, in Switzerland, which was the first country to deploy the Google Apple solution, among citizens who received positive test results. And what we can see here is that among 7,800 citizens who received a positive test outcome, 41 reported having been alerted by an exposure notification from the Swiss COVID app, which is being used there. And this number look embarrassingly small, if you think about it, compared to the almost 8,000 positive tests, but it should be compared with the number of tests that have been triggered by notifications from the conventional contact tracing process. And you will see here that the number is off by a factor of 10. And of course, it could be better, but here we face really what is our main barrier to make these systems effective, which is gaining widespread adoption. So we really would like that every individual person who has a smartphone, or most of them at least, would actually run the app to increase accuracy. But the real picture is somewhat different than this. So many, in countries where this has been deployed, many do not use it. and adoption peaks in Ireland, as far as I know to date, where approximately 40% of the population is using their local apps. And there are countries like Italy and France where really things didn't work out quite well and adoption is very low. And of course, if adoption is low, the accuracy of the system is affected because when individuals test positive, either they don't have the app, so they didn't broadcast anything that can help them alert other individuals, or they try to alert other individuals, but those that should be alerted, they were not running the app, so they don't have any notification. And so, in fact, what happens here is that we really face some sort of chicken and egg problem where accuracy of the system ends up increasing trust, but it is trust that increases adoption, which in turn increases accuracy. And so generally, low adoption numbers have been the result of prolonged debates in the countries where adoption is low. And countries where adoption is high are those that have navigated cleverly this chicken and egg problem, for example, with proper messaging to the population. And of course, there are also different cultural factors at play. As you can imagine, they might make these solutions more popular in certain countries than in others. Okay, this is not to say that a low adoption renders the solution useless. In fact, in reality, what we expect is non-uniform adoption. So we might have some pockets of high adoption, say like the campus of the UW, where many might end up adopting the solutions. And then we might have areas of the population where this technology is not pervasive at all. And what we can still do here, we can at least try to accommodate for this by shifting resources around in the conventional contact tracing process, by taking into account that they are more needed where technology is not effective and is not there to help. And this brings us to a final point, which, however, is an extremely important point, and it's inherent in this type of solutions. And this point is equity. Namely, it turns out that the parts of society that might need this technology the most also end up being those that have the least access to it. You know, age is certainly a factor, but also income is a factor. In fact, let me show you here two maps. And the map that you see on the left shows what is called the equity index in King County. So the brighter the color of a particular area, the more wealthy that area is and the less diverse it is. What you see on the right, however, is the relative occurrence of positive test results during the COVID pandemic. And you can see that it's pretty evident that the areas that suffered the most from the pandemic are low income areas. And these are also areas where the technology is less likely to be adopted, also maybe because not the newest smartphones are available or because other concerns are there. And again, the healthy approach that we have to think about here is to try to mitigate these effects by focusing conventional resources in contact tracing to those areas where the technology is not pervasive, and hope that the technology will help us reduce the workload on conventional contact tracing in areas where this technology is pervasive. So to conclude, I want to bring up a few remarks here. And an important point is that it should be clear from this lecture that exposure notification is by far not a silver bullet, and it was never meant to be one. And it can only be built on top of an effective test, trace, and isolate strategy. But there is already evidence that it does identify, when done right, otherwise undiscovered exposures. And also it has had a high degree of scrutiny that validates its privacy. It's not perfect by all means, but it's really the best we could come up with that can scale at this level to the entire world, and is better than other things we might have grown used to in terms of privacy. There is still some confusion here. In particular, it is easy to identify exposure notification and conventional contact tracing as the same thing, but exposure notification is in fact even less invasive. It really relies on your voluntary compliance, and no information is automatically exchanged with the existing contact tracing process. And I also want to point out here that apps can also help in several other ways beyond exposure notification. We didn't have time to discuss this, but it can help, for example, speed up contact tracing interviews, or help individuals track their symptoms. And all of these solutions are out there and have been discussed. And really, as the final point, I just want to point out that the biggest lesson learned for me and my team here has been really how hard it is to deploy such a solution, which is new to everyone at scale, and deal with the general mistrust. And the debate has been very healthy to a certain degree. It really raised the bar for what people perceive as good privacy to them, but it has also impacted adoption. And this is even more true because we are deploying something new and we need a leap of faith to try it out to see whether it really works. And there are valid counter arguments around, and maybe these apps are not needed. Countries like New Zealand did just fine without exposure notification apps. And so the question really I want to conclude here, and it's really the question for you, is to which extent are we willing, or is each one of us willing to accept such new and perhaps a little bit imperfect technology in the context of a pandemic? It's hopefully a one-off circumstance where we might want to just do our part here, even if this solution will not change numbers dramatically, but can still save a certain number of lives. So thank you so much here, and I'm very happy to move on to questions and answer any questions.
Fantastic talk. Thank you, Stefano. It sounds like we'll have an opportunity to engage directly with digital contact tracing in the months to come, so I'm excited about that. We have a little bit of time for questions, and a number have been pre-submitted, but I'll take the opportunity to ask my own question. As a bioengineer and an MD, I'm really interested about partnerships and when we cross boundaries in various disciplines, because that's how you get the hardest problems solved. Can you talk more about your partnerships that you had to build at the UW and within the state?
Yeah, certainly. So it's an excellent question. So the way the project started, in fact, and this may be an important premise here, was rather organic. So in fact, I joined at a point where some of my colleagues here in the Allen School had already started, at Microsoft, had already started developing an app, and they were starting to consider adding Bluetooth functionality, and hence the discussion of privacy was becoming important. And so for a while, it was really this project that was kind of, people were starting hearing about it and then wanted to join and bring in their expertise. And we have colleagues on this project that have been working for health authorities, even outside UW. We have colleagues in UW Medicine that have been taking part. And definitely it was one of the exciting part of the project to talk with all of them. Then as we actually moved more towards adoption in May, we started talking directly with the Department of Health. And in fact, we had to sort of step up the organizational side of the project and integrate it even more on the medical end. And that's where we started Common Circle, which is actually hosted by the Brodmann-Beatty Institute. So it's actually hosted in medicine, even though many of us on the computer science sides are still involved with it. And then the conversation went on, and we had very good collaboration with the Department of Health. Another factor here is that, so you ask about the UW, but also I want to stress that it was really a collective effort. So at some point, many of us who came up independently with these projects realized that we are facing a worldwide emergency, and there's no need to have fractured projects that are competing against each other. And so there was really a lot of extra input coming from health authorities all over the world about what was being needed and what they liked, what they didn't like, that came into this. So definitely this was very enriching here at the UW, but it went well beyond that.
Now we'll take some questions from our event participants. So you mentioned a number of countries that have had varying degrees of success in applying these exposure notification methods. And many have had effective communications out and getting their word out about these new apps. So what do you think these countries can teach us in the US and at UW, the state of Washington, about what we should do when we finally launch our apps in the state and at UW?
So I think that's an excellent question. And one of the main lessons that we have learned from other countries is that the messaging matters a lot. So in particular, you need to convince the population that the solution is to be trusted. And there are some challenges with that. I mean, for example, I'm the first to admit that the governance model that is currently in place for these solutions is perhaps not the one we had envisioned when we started. So tech companies really play a major role in the deployment of these solutions, and it is easy to fall back to the preconception that they're going to steal our data. And so it is really important here to persuade the population that the solutions that are being deployed, even though they come from Apple and Google, are essentially the system that have been designed in academia. For example, in Switzerland, which hosted one of these large projects called DP3T at EPFL there, the messaging has been very clear that the solution being adopted statewide, nationwide, even though it's the one based on the Apple and Google platform, is essentially the same system that was being developed by the university prior to this. And I am actually from Switzerland. My parents live there, and they do think of this as the EPFL app rather than the Google and Apple app. And this is really a success of explaining to the population properly that this technology is not something secret there, that we don't have any control what that companies are doing.
We've heard a lot about the inequities. Certainly you touched on them. We've heard a lot during the pandemic. So is there any conversation about how we should address the technology inequity in the exposure notification space?
Yes, there is definitely a lot of discussion about this. It is a problem that I think by this point everyone recognizes. That doesn't mean that technology here is the right side to offer a solution. So what I mean by that is that, unfortunately, we cannot reach out with technology to those who don't have access to it. So the solution that we have to keep in mind is a more holistic approach to this, where we accept that we cannot reach out to certain parts of society with this technology, but we can try to make it as effective as possible in other parts. And the healthy way to interpret this is not to reduce the existing resources in the conventional contact tracing process, but rather to direct them to those parts of society that need it the most. And that can help. Of course, it's hard. We are starting to deploy this, and a lot of time it's really about building the airplanes as we fly it, as you could say here. And so we will have to see and pay attention to that. And so hopefully, we will do the right steps here, and that's important. On the other hand, I don't think that's a reason, as I said, to discard this technology simply because of that. Because if we do it right, we can free up resources that can be used elsewhere when they are needed, where they're needed the most.
So another question from the audience that I am particularly interested in: if you're asking people to use an app that will be constantly using Bluetooth to regularly broadcast information about exposure notifications, how will that affect the battery life for the user? Do you think shortened battery life will influence how many people are willing to use the app?
Yeah, so that is an excellent question. So in fact, it was one of the biggest concerns we had at the beginning when we started designing the system. So battery life, together actually with data usage, right? So depending on, maybe many have unlimited data, but not everyone. And we want to make sure that we're not consuming too much data for this application. So this was in fact one of the main advantages on having Apple and Google work on this, because they could integrate the solution with the operating system, and this makes the solution energy efficient. I cannot give you concrete numbers because they vary a little bit depending on which phones you're concretely using. Some of them might be more optimized than others, but definitely the current footprint in terms of battery consumption is very minimal. We might be using already other types of Bluetooth things like earphones and other things that are much more consuming than that. It's really about the phone sending out regular advertisements, what we call them, over Bluetooth at regular intervals with these random numbers in them. And definitely there is some impact on the battery, but it's much lower than one would think. And the same is true for data. So even as we try to scale this nationwide, there are going to be regular downloads that the phones need to perform to check simply whether they actually have been exposed. And so the plan is to actually have, as present, one single national server to keep it simple. And there will be just regular downloads from the server. But again, because of how the system actually compresses the signals in a fairly clever way, the bandwidth to download this is somewhat limited.
So we'll take one last question from the audience. And another, I think, critical question, we've got hardworking academics busily building these apps. Google and Apple are pitching in, but surely there'll be more costs. So how is the bill for all this development going to be paid?
Yeah, so it's a great question that I think we all wonder about as taxpayers. I am not probably the best person to give you the exact answer to this, but I want to answer this that definitely there is a cost in a sense that we initially, right, so most of the cost was due to academics actually working on this. We had volunteers at Microsoft working on the solution specifically here. So what that means is that they were remaining Microsoft employees, but they were allowed to engage in volunteering work. And many companies actually did this during the COVID pandemic. So it is definitely a cost. I like to believe that this part at least is a well-spent cost in a sense that we are researching things and we're trying to see whether they work, and we're trying to assess feasibility. And this is something that needs to be done, if not at any better time than now. There is a certain maintenance cost of running this. I think as things are right now, cost has been a factor. I think especially in the United States, with the arrival of Exposure Notification Express that I mentioned before, with a direct Google in-house solution, this is going to keep the actual operating cost fairly low on the side of states. And this has been actually a main factor for all of the states that didn't have much resources. Obviously, there are some issues, so users need to be helped if they're stuck with things. But I like to believe that among different things, this is not an incredibly expensive, it's not an incredibly expensive operation.
This concludes our event for the evening. I want to thank you, Stefano, again for a really fantastic talk, and for all of our audience for joining us tonight to learn more about contact tracing and the apps. If you missed part of this fantastic talk, the lecture will be available online. In the meantime, take care and have a good evening. Thank you.